Good afternoon, everyone. Welcome to this live session on diabetic surgery. We have Dr. Raman Goel, who is a senior practicing surgeon for last 35 years. He's a pioneer in bariatric surgery and has launched diabetic surgery with Wokhard Hospital recently. He's also the editor of Journal of Bariatric Surgery and is on editorial board of many other international journals. So I hand over the session to Dr. Raman Goel.
So this particular session is very important because this has come after the launch of the diabetes surgery clinic in Wokhard Hospital. And there's been a lot of excitement among people about what exactly this surgery is and how it is done. Does it really work? People had great doubts about the authenticity of the statement that diabetes can be treated surgically. So keeping that in mind and a lot of questions that were coming to us, we thought it's a good idea that we directly talk to you, take your questions, and provide solutions to all these doubts that are being raised. So I'll start my presentation and then I'll keep along. And you please feel free to ask questions and share your questions with the number that I'll share on the screen. So this is on behalf of Center for Metabolic Surgery, which is at Wokhard Hospital, Mumbai Central in Mumbai. And I'm going to talk about diabetes surgery, which in medical term is also called a metabolic surgery. Now, diabetes surgery is primarily for those people who have been diabetic for a long time or a short time and have been taking medicines and are not getting well controlled. So we'll talk about it. The reason why this surgery is especially more important for Indians is that almost 8 crore Indians have diabetes. And despite all the lifestyle changes and medicines that are advised, almost 78% of them remain uncontrolled. And that is why this surgery is important, that we offer a treatment option to those people who are not able to control their their diabetes, sorry. Because in uncontrolled diabetic patients, most of the complications happen. Whether they have the nerve problems where they feel the sensation in the feet, or some diabetic people lose their vision because there's a diabetic retinopathy. A lot of patients who have heart problem are primarily diabetic. So the heart attack happens because the blood vessels in the heart, they get blocked with the diabetes related issues. Same thing happens in kidneys. 50% of kidney failures are in diabetic, and same thing happens in brain strokes, and there are many more. If you have any questions, please WhatsApp them on this number and I'll try to answer them at the end of the presentation. Please remember, diabetes surgery is an treatment option. It is not an alternative to medicine. So patients who can be well managed with medicines can continue to take their medicines, and they are not required to have surgery. But those who are not well controlled can have this surgery to get a better control. Now, what is diabetes surgery? I mean, people thought that, why I have not discussed what this diabetes surgery is. Diabetes surgery is basically what we call as metabolic surgery or bariatric surgery in patients who are more than 35 BMI. Now, BMI is something that you can calculate online, your BMI based on your height and weight. But what has led to this change recently, what has led to this excitement recently is that on 1st December 2022, international guidelines have been changed, that now we can offer this surgery to somebody who's 27.5 BMI and if his sugar is not well controlled. Now, I cannot offer this surgery for weight loss at 27.5 BMI. So if somebody comes to me who doesn't have diabetes but wants a surgery, I will not do it. But if the same person at 28 BMI has uncontrolled diabetes, I can do it mainly for diabetes treatment. Now the surgeries remain the same. These are the same bariatric surgery or metabolic surgery which we have been doing for almost 50, 60 years worldwide and in India for the last 25 years. So the surgically, what is done in these surgeries that we reduce the size of the stomach, and in these two of the surgeries we join the intestine to this. So the idea is that the food goes out of the stomach faster in the intestine, either in sleeve or in a bypass, where the food does not have to go all the way. It directly goes in the intestine and reaches distal part of the small intestine. Now, who are good candidates for surgery for diabetes? As I mentioned, 27.5 BMI, layman terms, it means if the person is around 8 to 9 kgs overweight, he may qualify for diabetes surgery. The second requirement is that diabetes has to be uncontrolled. Just because somebody has diabetes, it doesn't mean that the person should undergo surgery. So if the HbA1c is at least 7, then he's a candidate. And the third requirement is that the person should be suitable for anesthesia. So that is something that is assessed by the anesthetist in the hospital, and we are able to see that, and the anesthetist gives a fitness for surgery. Now, what is this surgery? These surgeries are laparoscopic surgery, or what is called as a keyhole surgery. Usually it is done within 1 to 1.5 hours. Most of the time, patients stay in hospital for about 2 nights after surgery. They are allowed to walk and drink 6 hours after surgery, and they are able to resume work within 4 to 5 days. So the advantage of keyhole surgery passes on to the patient who needs it for diabetes, and they can have a lifelong impact on their diabetes. How does this surgery work? Because many patients have asked me, people have called me from all over the country, that are we operating on pancreas? How does the pancreas improve? So friends, it's not done on pancreas. As I've shown you, this is done on the stomach and intestine. And as the food goes to the last part of the intestine faster, it leads to secretion of a hormone called GLP-1 hormone. There are many other hormones which are secreted, but specifically GLP-1 hormone. GLP-1 hormone is known to reduce insulin resistance. It increases insulin production from pancreas, and it is also believed that it increases number of insulin producing beta cells in pancreas. So all this helps in control of diabetes in a patient. And since it is related to the food, so if the person is eating more food, then the GLP-1 secretion is more. Person is eating less food, GLP-1 secretion is less. And thus the possibility of hypoglycemia is practically not there, or let's call it, it's very rare. Unlike the medicines where they are fixed dose medicines, and the possibility is there. It also happens because there are certain change in gut bacteria. It also happens because after this surgery, patient is eating less food. So all these factors together lead to a situation where the sugar is better controlled. Now, when we say they are better controlled, what do we mean? What are the real-term outcomes? So the outcomes are that 80% of diabetic patients after this surgery go in resolution. That means their HbA1c goes below 6.5 and their fasting glucose is normal without medicine at 1 to 2 years. So, 80% go this way, and the 20% will have a better control. But look at this. The next study shows that even after 10 years, 36% of these patients will still not require medicines because their sugars will remain well controlled. So this is the significance of this surgery, that it leads to very good control or excellent control based on the patient's assessment, and a very large number of them are off medicines even after 10 years of surgery. And it's important to realize that for every 1 year that the person is in remission, that means HbA1c is below 6 or below 6.5, the complications or the microvascular disease reduced by 19%. We are talking of control of this remission for 10 years or more. Now, what are the complications which get reduced? How much they get reduced? So these are all international studies which have shown that there's 75% reduction in macrovascular complications like myocardial infarction or heart attacks, as we call them, brain strokes, and even death. There is 90% reduction in microvascular complications of diabetes like amputations. And there is 65% reduction in blindness and angina. So this is the kind of significant effect seen after a diabetes surgery on diabetes complications. There are many other benefits of this kind of surgery, which is not directly related to diabetes, but merits a discussion. That almost 20 to 40% patients will not require medicines for blood pressure. Triglycerides reduced by 50 to 100 milligram. And there is a significant risk of heart attacks even after 10 to 11 years. 50% reduction in myocardial infarction after surgery at about 11 years. And all these benefits leads to reduction of heart disease related deaths by 56% even at 10 years. And there is an increased life expectancy of around 9 years in diabetes surgical patients. So friends, it's not a question of blood sugar control. Many patients are coming and talking to me and saying, will the medicine stop completely? Medicine stoppage will automatically happen if the sugars are well controlled. So our target is medicine is the diabetes control. Now, obviously, if somebody has diabetes for 25, 30 years, pancreas are damaged, they may not have complete discontinuation of medicine, but their sugars will get controlled. So I think it all depends on at what stage of diabetes patient is coming to us, but almost 56% reduction in heart attack after 10 years is an important finding of this surgery. How can we improve long-term control of diabetes after surgery? So we generally advise patients that they must continue to avoid foods which are not advised for diabetes patients. They must continue to exercise regularly, and it is preferable that they do their 3-monthly blood sugar or HbA1c every 3 months for rest of the life, so as to know whether their sugar remains under control even after 10, 15, 20 years. How do we predict? As I said, it will depend on patient to patient, the outcome of the surgery. So it depends on for how long patient is diabetic, depends on their BMI or body mass index, depends on their age, and depends on pancreatic function. And all these things are evaluated by our team at Wockhardt Hospital before surgery, so that we can give a fair assessment of what kind of control you are expecting. Are you going to go in a remission without any medicine? So those discussions happen before surgery is done. The second question comes is that people do ask, is this surgery dangerous? Now, just because diabetes surgery has started recently does not mean that this is a new surgery. We have been doing the same surgery, whether it's a sleeve or a gastric bypass, personally for last 20, 22 years. So it's not a new surgery for us. And even bariatric surgery is less risky than, let's say, a gallbladder surgery today. There are enough publications to support that the risk of death from any surgery, from a bariatric surgery or a diabetes surgery, is less than that in a gallbladder surgery. So this picture is to say that the proof of pudding is in eating it. I'm showing 4 patients whom we operated, last 4 patients whom we have operated recently. So let me just try to highlight one by one so that it's easier to understand. This gentleman was 64 years old and 84 kgs. He has diabetes for 14 years. He was uncontrolled diabetes. His HbA1c was 7.7. And even with medicines and insulin, his fasting sugar was 184 and post-meal sugar was 358. We did his surgery on 19 December, and 2 days later we stopped his insulin. And now his fasting sugar remains between 120 to 150. So this is the kind of improvement without insulin within 2 days, and now for almost 20 days he is maintaining like this. This lady who is 50-year-old was 87.3 kgs, diabetic for 6 years. She's a healthcare worker, works in a hospital. She was on 5 medicines for diabetes, including insulin. But look at her HbA1c, it was 15, fasting sugar was 240, and post-meal sugar was 450. We operated her on 24 December, and her insulin is stopped on day 3. And just on 1 or 2 medicines, she's maintaining her sugar. Generally, medicines are given to every patient for 2 to 3 months. And as their sugar become normal, the medicines are withdrawn. So if somebody is taking two tablets, maybe the person will come down to 1 tablet, and those who are taking 1 tablet may stop completely. Third patient, we operated her. She's 53-year-old, 74 kgs, diabetic for 11 years, HbA1c of 9.5, fasting sugar 224, postprandial sugar 350. She was on oral hypoglycemic, that means tablets and insulin, operated on 26 December, and insulin stopped on day 3. So these 3 patients were on insulin and is still uncontrolled. And they were under treatment of very good physicians, but the disease was like this, that the sugars were not getting controlled. And then we had another lady, another healthcare worker. She is 53-year-old, just 73 kgs, diabetic for 1.5 years. She had done her research. She says, I don't want to wait 5 years to have this surgery, because those who come early for surgery have better long-term outcomes after diabetes surgery. So she had done her research well, and she got her surgery done. She was only on tablets. And by the time we discharged her from the hospital, she's not taking any medicines anymore. So these are the kind of results that are seen. Friends, I'm receiving your questions. I'll answer them. If you have more questions, please send them on this number. And these surgeries are covered under insurance. Only thing is that insurance up till now covers them above 35 BMI. The new guidelines have hardly come 1.5 months back. We are pursuing them with the insurance companies, but generally they take time to make a change. And as soon as it is done, which may take maybe a few months, maybe a few years, I'm sure that this surgery in low BMI patients will also be covered. But it is all covered for 35 BMI and above. For diabetes, they do make payment. Most of the surgeries that we are doing at Wockhardt Hospital in about 35 BMI patients are being done on the cashless basis, and obviously subject to certain approval criteria by the insurance company. So friends, I would like to conclude. My take-home message for you is that diabetes is a major problem in India, but 77% of them remain uncontrolled. So exposing them to risk of heart attack, kidney failure, vision loss, brain strokes, and nerve diseases. Diabetes surgery produces resolution or control of disease and associated diseases as hypertension, blood pressure, cholesterol, and inflammation. These surgeries are associated with 50% reduction of heart diseases and similar reduction in 10-year heart disease related deaths. So I think overall diabetes surgery is a good option for majority of those patients who are not controlled. I agree, I cannot provide all the information because every patient has to be assessed individually. We have received those who have registered for this program. We have received your details, and my team will follow up with you, contacting you about your suitability for surgery. And please feel free to contact us for any more details if you have any questions. These are our contact details. You can send a mail on this email ID, or you can send a WhatsApp message. I wanted to play a small video. Let me try if it can work today. And
हेलो, मेरा नाम प्रीति शार्दुल है और मैं 63 इयर्स क्रॉस कर चुकी हूँ अभी। तो डायबिटीज़ की तकलीफ़ से बहुत परेशान थी। 3 बार इंसुलिन लेना पड़ता था, 35 यूनिट्स हर टाइम। तो परेशान हो गई थी। किसी ने डॉक्टर गोयल के बारे में बोला तो सोचा कि ये भी ट्राई कर लूँ अभी। ऑपरेशन के बाद तो मेरा एकदम लाइफ ही चेंज हो गया है। अभी पहले मेरा वज़न 93.4 था बिफोर सर्जरी, और अभी है 68 to 70 के बीच में रहता है, फ्लक्चुएटिंग। और अभी जस्ट मैं यूरोप ट्रिप पूरा घूम के आई हूँ और मुझे कुछ भी तकलीफ़ नहीं हुई। 200 सीढ़ियाँ एक साथ चढ़ सकती थी, उतर सकती थी, कुछ भी प्रॉब्लम नहीं हुआ। और गोलियाँ, इंसुलिन तो पूरा ही बंद हो गया, और गोलियाँ भी खाली एक गोली है ग्लाइकोमेट की, बाकी कुछ भी नहीं है। और जो अपने के विटामिन वगैरह लेना पड़ते हैं वही, बाकी कुछ नहीं है। तो थैंक्स टू डॉक्टर गोयल, मधु गोयल और शर्मिला।
this is about the surgery that we discussed. And if there are any questions, please send them to us on the number that we have shown. I have a question from Mr. Ajay asking what is the estimated cost of the operation. So Mr. Ajay, primarily if this is controlled under insurance, the insurance bears the entire cost, and that is the worked out arrangement between hospitals and insurance companies for any other surgery in the country. But if we are looking at a payment which patient is going to make, then it will depend on which surgery we have selected. There are 3 types of surgeries as I had shown, and the cost will vary based on that. So if you send us the details, we will evaluate your details and we can specifically tell you what will be the cost of the surgery. Any other questions? Are there any other questions in the Facebook chat? All right. So if there are no more questions, I'll say thank you for joining this program. We are accessible to provide you more information. I am aware that there are a lot of doubts in people's mind, and we are here to provide you scientific information so that you or your relatives or your near dear ones can benefit and can have a healthier and longer life. I have shown you some of the data, some of the scientific data, which shows that the diabetes can be better controlled, complications can be avoided, and the person can have a longer life by about 9 to 9.5 years. Have a good day. Take care. Bye-bye.